There are so many therapeutic modalities. Let's go through every single one that I use and treat every single common problem, okay? And we're going to do this alphabetical order. We're starting with anxiety and acceptance and commitment therapy. With acceptance and commitment therapy, ACT for short, anxiety is not something we try to get rid of, but it's basically something we try to deal with and live with a little bit differently. Step one is to accept the thoughts and feelings to be present. This basically means acknowledging that your anxiety is there and allowing it to be there. We don't try to fight the anxiety and push it away. The more resistance that we have towards this anxiety, the louder it can get. Instead of thinking, oh, I need to get rid of this, ACT teaches you to think I'm noticing that I'm feeling anxious right now, and that's okay. ACT teaches us to accept what we can't control, like our anxious thoughts. Anxious thoughts can come up at any time. ACT really helps us to commit to actions that will take us towards who we want to be. Step two is to choose a value direction. We do this through a process called cognitive diffusion. We want to be able to view ourselves as existing outside of our thoughts, because at the end of the day, thoughts are just thoughts. They're not facts. They don't actually represent who we are. This process helps basically give less power to those thoughts. For example, if you're feeling anxious about failing a test and your anxiety is telling you, I'm going to fail the test, I'm not going to do great, this is where you would respond and reassure yourself that you are just having anxious thoughts about failing the test. You don't need to judge these thoughts as being true or false. Just because I'm feeling anxious about the test doesn't mean I'm actually going to fail the test. Step three is to take a committed action. Once we can observe experiences and not be directly caught up in them through that cognitive diffusion, practicing identifying that you're having anxious thoughts and not really feeling attached to them, we can then take action towards what matters. If anxiety shows up before a big step in your life, for example, before a big test, instead of shrinking away, ask yourself, can I carry this anxiety and still move forward towards what matters? This is how we move forward with fear, not after it. You're going to have to write that test regardless of how anxious you feel. This is where we can kind of take the committed action to making sure, okay, did you study enough? Are there some resources that you can use to try grounding yourself? For example, taking deep breaths, doing a 5 senses grounding technique, making sure that you have all the supplies you need for the test, and reminding yourself that you know what you're doing, that you're going to be okay regardless. It's so funny because sometimes anxiety will be at highest right before the test, but as soon as you start writing the test and you start pushing through that anxiety, pushing through the fear, a lot of times we have to do things even if we're scared, that anxiety starts to dissipate. And when you're able to do that over and over and over again, you kind of train your brain as to not needing to react to this with anxiety and with fear. If you want support applying this in your life in your own tailored way to your unique circumstances, then book a session with me and we can figure it out together.